Hello, welcome to another weekly update of COVID-19 here in Davie County. We have, as we told you in the past, reduced the frequency of these, so it's really a bi-weekly or monthly update now because we have less to tell you and we want to be mindful of your time. So when we have updates and pertinent information, we'll get that out to you. But today we have some guests with us, and we'll be going through those. So we have our Superintendent of Davie County Schools, Mr. Jeff Wallace. We have Luanne Angel here with us from our Health and Human Services, and Johnny Lambert with us from our Public Utilities Department. And so that'll be our lineup for today. It's been a very busy week in many of these areas, but I'll start out by, again, thanking our community on behalf of Assistant County Manager Robin West, myself, but also the Board of County Commissioners and everyone in our community who continues to respond to COVID-19 and the families that all of us are serving together. So we thank you for all of our volunteers and responders and personnel for what they do each and every day to continue moving us down the path from where we started. It seems like forever ago, back in March. So today we have team members to give you some quick updates, and we'll start with our Superintendent of Davie County Schools, Mr. Jeff Wallace. Mr. Wallace.
Good afternoon, John, and folks on the call and guests. Yes, thank you for the opportunity. Well, Davie County Schools is rolling along. We are in session, of course, still operating under Plan B. That was directed by the governor, where students attend on an A day, B day, with Wednesdays being dedicated to remote learning and additional cleaning in all of our facilities. We also are continuing with our Davie County Schools virtual option for parents. We have around 900 to 950 kids that are in DCS virtual. I will say that that's definitely been a learning experience. But you typically don't try to organize and open up another learning opportunity or basically a whole school over a summer. But I commend our staff, parents. Thank you very much for your patience. Thank you for your input. It is vital. We do not have all the answers, and I do apologize for the mistakes we've made, but I can assure you we are listening and we're working through those. And again, I commend our staff for staying the course and doing what they should. Overall, things are going pretty well. When you consider the things that we're facing, and knowing that we have so many students and people on all various campuses, or 12 different campuses each day, which again, Plan B mandates that most of those are operating about 50% capacity. Keep in mind, we are able to bring our kindergarten, first grade, and second grade students into the school building Monday, Tuesday, Thursday, and Friday, because we can maintain social distancing with them in our building. Now, we will admit that superintendents were thrown a curveball last week when the governor announced that school districts may move to Plan A with K-5 students only, or grades K through kindergarten through fifth grade. I just want to make sure people do understand that, because that does not pertain to 6 through 12. So again, the governor said we can move to Plan A, which would mean students can return. Now, that doesn't mean they can return as we did before COVID. There are still stipulations in place. That is a huge decision. We have things, again, are going well under Plan B. So I will tell you that I've worked closely with the board. We are meeting with them again. We have another regular meeting, but we are in constant communication about this, working with Luanne and Suzanne. Luanne's on the call today. Suzanne Wright and her team. We are working with state officials, High School Athletic Association, various groups, trying to gather information before we make a decision. I clearly understand, and let me say this again that I've mentioned on this podcast before. We want kids in our building. We know that the best place for our children to learn, for the most part, for most all children, is in our building. But we also understand we're dealing with this pandemic. But we will not make a knee-jerk decision, irrational decision. We will gather information, which again I mentioned prior to going live on the podcast that I was involved in the superintendent's meeting, a statewide superintendent's meeting at 12 o'clock today. It was very intense because we're having to make real life decisions about getting children in the building, which we know is the right place for them to be, but they also have to be there in a safe, where the buildings are safe. So community, parents, we are working again with the folks I've mentioned to try to gather data and information before we make a decision about moving forward with bringing K-5 back in the building. Again, overall, I think it's going well. I commend our staff, our parents, and everyone for what they're doing. And please, if you have questions or feedback, we ask that you contact us. Contact me or my office. You can go to our website. We have a tremendous amount of information there. And we'll just continue to move forward. It is great to be back in school. Currently, we are aware of two staff members that have confirmed COVID cases, and one and maybe another that I found out today about a student. But again, we have not had any clusters, and I'm very thankful for that. But we will continue to be open and communicate with our schools, with our parents. And again, when you hear me say that we have cases, please rest assured, parents and community, if you need to be contacted related to a positive case, the health department will reach out to you. Again, thank you, and be glad to take any questions when just send those to us. And again, thank you very much for the opportunity, John.
Thank you, Mr. Wallace. I've said numerous times that our community, our local governments and our schools, we were all early implementers of mitigation response. And I think Luanne and Suzanne and Melissa and others at our public health department for what they did to consult with us all, and also our business community. And I really think because of that, our numbers have been mitigated so much compared to others, because we started very early on doing great strategic work, and I think that carries through to today. So, Mr. Wallace, just want to say the fact that after reopening you haven't had any clusters, I think is a testimony not only to you and your staff, but our public health team and the consultation they provide. So kudos to both of you for doing it right. We know we only have control over certain things. When the state makes certain decisions, we try to respond the best we can locally. And so your work and the Board of Ed's work has not gone unnoticed. There's no easy answer that pleases everybody, but I think the most important thing is all of us see you trying really hard, and we thank you for that hard work. So with that, I think we'll transition over now to Luanne Angel, who is here to present to us some numbers and information regarding COVID-19 as part of the Public Health Division of Davie Health and Human Services. So Luanne, we'll turn it over to you.
Thank you, Mr. Eller, and thank you to our county partners, particularly the schools, and to our residents. I'm participating today on behalf of Suzanne Wright, our Health and Human Services Director. As far as numbers go, as of this morning, September 23rd, there have been 554 cases of COVID-19 confirmed and reported in Davie County residents. There are currently 20 active cases with 3 persons hospitalized. Thankfully, our death count has not increased and remains at 9. As of Friday, 9/18, there had been 6,840 tests for Davie residents. That number does include some duplicate testing, particularly in long-term care facilities. Our age group of 25 to 49 continues to be the group with the highest case count at 218. The next are ages 50 to 64 at 117, ages 0 to 17 at 87, ages 18 to 24 at 70, and over 65 and over remains to be the lowest case count at 62. We would like to point out that all that the staff and students in Davie County Schools are doing, it's been such a great job working with them, following their 3 W's, our 3 W's, wearing a mask or face covering, waiting at least 6 feet and avoiding close contact, and washing your hands or using hand sanitizer. We continue to encourage families to continue these practices at home and when they're out and about. Parents who model these behaviors are setting a really good example for their children and other loved ones. We are also here at Public Health continuing to work with our long-term care facilities to support their federally mandated point-of-care testing for their staff. All the facilities here in the county are reporting their findings to Public Health and have been very diligent in their work, and we appreciate that. That's information that I have today. If citizens have questions, please don't hesitate to call our COVID-19 call center here at the Health Department, 336-753-6550. Thank you.
Luanne, no one knows, other than those of us who work with some of you, how many hours all of you put into this response, and that absolutely doesn't go unnoticed as well. So we thank you for your leadership and for the many late nights and extra hours that you're putting into this to keep us all safe. We really appreciate you.
We appreciate your support.
Okay, thank you. We'll turn over now to Public Utilities, and Mr. Johnny Lambert's here to give us some quick updates. Mr. Lambert?
Thank you, Mr. Eller. So currently the utilities are no longer working under any governor's executive orders. So we are still encouraging residents to call and set up payment plans if they have not done so. But currently we are moving along every day. So again, at this point, we're just asking residents who owe balances prior and cannot pay their bills to call the office and set up payment plans. And that's all we have for today, Mr. Eller.
Thank you, Mr. Lambert. We appreciate you and your team very much. So for the community, this is the last call we may have for a few weeks until we see how the response unfolds. We know that we're getting most of our information and directives now from DHHS and the state office now that the phases seem to be relaxing and more to come. So the frequency of these podcasts and updates will be determined at a future point in time. But until then, we did want to encourage anyone who has a question or comment to be able to get that to us. The link here on the screen is how you can do that. Regardless of whether these calls are continuing weekly, bi-weekly, or monthly or not, this is still a way you can get information to us. So we do thank our community for the response that they've given. I thank all of our partners on the phone and even those who couldn't join us today. But we very much appreciate the communities rallying together to respond to COVID-19. And our prayers go out to the families who have been impacted by this and whose family members continue to be. So thanks to all of our professionals out there helping during this time. We love you, we appreciate you and value you. And so with that, we'll conclude this week. Thanks to all our panelists on the call today, and we hope to give an update to everyone here in the future. Take care.